Okay, so let's finish up week 1 lecture. This is going to finish with chapter 4. So here we really start to move into the meat of the text. It's important to recognize that during RN school, you will grow and change, and part of that is facilitated or made easier by socializing with your peers in RN school and by socializing with RNs who are already in practice. It may become difficult when the things that you were taught in LVN school are no longer the standard, and so it can feel weird when what you thought you knew turns out to be outdated. Clinical experiences should help you practice your new role. When you go to clinical, remember you're not there as a practicing LVN. You are there practicing the role of the RN. Sometimes it may feel like there are few differences between the LVN and the RN, but it is your job to look for the differences. One of the challenges you may face is role conflict. This is when the people around you have an image of who you are based on who you have been, and it can be difficult to do new things that may conflict with what people know about you already. Be sure to maintain open communication with those around you about the ways that you're changing. This will help protect you from the strain of role conflict. You learned about role elements in Chapter 4 and in the pre-lecture video. If not, you can use your textbook while doing these questions. Just use the index at the back of the book to locate the section on role elements. When reviewing discharge planning with a patient, the registered nurse reviews new dietary modifications ordered by the healthcare provider. What role is this considered? A. Counselor. B. Advocate. C. Manager. D. Educator. Okay, so in this instance, I'm looking at what the nurse is doing and her role. So I see that she is reviewing discharge planning with a patient, and she's reviewing new dietary orders. So that makes the current role for that nurse educator, D. She's educating the patient about new dietary modifications. The registered nurse is caring for a 7-year-old child with a spiral fracture of the left lower extremity. Assessment findings include bruises at various stages of healing on the chest, back, upper, and lower extremities. The nurse recognizes these findings as potential signs of physical abuse and notifies the healthcare provider and Children's Advocacy Center. What role is this considered? A. Counselor. B. Advocate. C. Manager. D. Educator. In this situation, the nurse is acting as an advocate. She is doing something for the patient that the patient can't do for themselves. What are the differences between an LPN or LVN and RN roles? Select all that apply. When you do a select all that apply question, you basically answer each of the letter options at the bottom, whether it's true or false. So is the educational level different between an LVN and an RN? Yes. Is the orientation to the use of critical thinking skills different between the LVN and the RN? The answer is yes. Are the education and practice time with assessment skills different between the LVN and the RN? Answer is yes. Are the patient teaching skills different between the LVN and the RN? The answer is yes. Is the care planning participation different between the LVN and the RN? And the answer is yes. And lastly, are the legal responsibilities different between the LVN and the RN? And the answer is yes. Let's talk a little bit about the educational preparation. Before I discuss the different types, I want to say that this information is what is generally accepted across the United States and on the NCLEX, but you may find that your experiences and the area in which you practice will have an impact on what you see possible for those who obtain the different types of degrees. So, diploma programs started in the 1800s and they are hospital based. They have a lot of clinical hours involved, but they're pretty short on general education courses. So, nurses that come from diploma programs will be very good at caring for their patients, but they may struggle to become nurse leaders. The next type of education is the associate's degree program, and the first associate's degree program started in 1952. It's the most common type of basic nursing education in the United States. It typically takes 2 years at a community college. It makes for good acute care and long term care nurses. Nurses that graduate from an associate's degree program may lack some variety in the type of nursing courses they take, including things like missing out on a nurse leadership course, and therefore they may struggle with leadership roles as well. The baccalaureate in nursing degree was first introduced in 1919, and it takes about 60 credit hours of nursing and then 60 credit hours of general education courses. It includes entire courses on leadership and possibly courses on community health, or maybe even an entire course on nursing informatics. Baccalaureate prepared nurses may come into the field needing as much time or even more time to orient to the field of nursing or to their nursing unit, but they do acclimate to nurse leadership roles more readily than associate's degree nurses. Master's prepared nurses, it does require higher education, and they often work in staff development or administration. Sometimes they might become CRNAs or certified registered nurse anesthetists or FNPs, family nurse practitioners. It does require 1 to 2 years more of schooling than a baccalaureate degree typically. And then there's what you call a terminal degree, which means the highest level of education you can reach in nursing, which is the doctorate level nurse. And these professionals often end up being researchers or teachers in nursing programs. So they require an additional 1 to 2 years of school on top of the master's. Plus, they're required to pass an exam and they have to do either a dissertation or a project. So they require an extra 4 to 7 years, depending on the research that they do. I do want to say that there are a lot of combined programs out there now trying to enhance the ability of nursing students to go for the next degree. So, some of those estimates for the number of years that it takes to earn those degrees might be altered based on the type of, program that a nurse gets into. So, I have another practice question here. A licensed practical nurse or licensed vocational nurse is participating in an RN program based in a community college setting and will complete the course of study in 2 years. What type of nursing program is this most likely considered? A, diploma, which is in a the hospital based type. B, associate's degree. C, baccalaureate. And D, master's degree. So 2 years at a community college means you're probably earning an associate's degree in nursing. A little bit of vocabulary that can help understand the profession of nursing. There's accreditation, and accreditation tells the public that a nursing program meets national standards. So there are two accrediting bodies for nursing programs. We have ASIN and CCNE. Amarillo College is accredited through ASIN. ANCC provides nurse specialty certifications. ANCC stands for the American Nurses Credentialing Center. They do have 46 different certification programs, and earning a certification through them requires you to have a certain level of education, experience, and training, all three. Once earned, the certification validates your knowledge, it helps to build confidence, it increases your earning potential, and it may even provide career opportunities that you might not have otherwise had. Perhaps it will even give you the extra edge ahead of someone else when you're interviewing for the same position. Lastly, professional nursing organizations. The American Nurses Association represents all the nurses in the United States. They promote our rights, they project a positive yet realistic image of nurses, and they lobby for us on issues that would affect us. You can join the ANA online, actually. And their website does have a lot of resources that you can utilize. Scope of practice identifies the responsibilities of nurses depending on their educational preparation and licensure. It's defined by individual state nurse practice acts, and it's the State Board of Nursing that ends up getting set forth by the Nurse Practice Act, and it gives the State Board of Nursing the authority to carry out rules and regulations. The National League for Nursing has defined three primary roles of the registered nurse. If you look at your CPECs, which is how you receive your grade for your clinicals, you'll see that the skills that you must demonstrate to pass clinical fall under each of these three categories. First, providing direct care to patients and families to help them heal. The second is manager of care, which really highlights how you will be a full team member in the healthcare team, collaborating with other healthcare professionals to ensure the proper care is provided to the patient. It also includes advocacy. And then, as a member of the profession of nursing, the associate's degree prepared registered nurse assumes individual accountability and responsibility and embraces lifelong learning. This means the nurse cares about what happens to his or her patient and works to ensure that he or she provides quality, holistic care. It means that the nurse learns more and practices to the full extent that they are able. It means that the nurse participates in improving the profession. I have a little story time. I was teaching CPR classes, and I had an LVN working at a clinic, and she believed that because she worked in a clinic that she didn't need to know CPR because her patients didn't undergo codes. They didn't code in the clinic. And I was just really surprised by that thought process. And I bet there's not a single person listening to this lecture that would agree with that nurse. But I want you to just remember as you go throughout your career that you should always continue learning. And each learning opportunity, even though it may take away time from something else you'd rather be doing, it does give you a chance to become a better nurse and a better version of yourself. If you have questions, please contact me. We're going to look at a quick case study. Nurse Amy has been working as an LVN in a hospital setting for several years. She's working on the weekend once a month because she's returning to school to be an RN. As each week passes, she's starting to realize the difference between her current role as a nurse and what her new role will be like. She's eager to ask more questions at work about the care of her patients and has developed a mentor relationship with the charge nurse who works her weekend. Amy is realizing that many of the things that she's done during her nursing career are the same things she's going to do as an RN, but now she must gain a whole other aspect of the role of nurse from an RN perspective. As she is becoming more and more interested in fulfilling her new role, it has helped to motivate her to keep up with her studies and be successful in school. However, Amy also works with a close friend who attended LVN school with her and has not decided to further her nursing education. This has caused some tension in their relationship because Amy not only has befriended the weekend charge nurse as a mentor, but has also pursued more information on her patients and could possibly be taking on a new job as an RN at the hospital when she graduates. Amy is troubled by this and hopes that her personal and professional goals will not become an issue for herself or between her and her longtime friend. So, how will you feel as you transition from an LVN to an RN? Do you have any similar situations to this where you feel like there may be something becoming between yourself and maybe some other LVN friends that are not pursuing an ADN or an RN education? How do you think nurses can work together to avoid conflict in the workplace? How can current nurses work to encourage fellow nurses to pursue their goals without feeling threatened? Have you ever experienced any of this before? And how did you feel? How do the RNs that you work with view your transition? Those are just some good questions that you can ponder as we continue forward with your ADN education. And if you ever feel like you need to talk to someone about any of these, please reach out to your local instructor. We are all willing to help you think through. If you have any questions, please contact me.